everybody, and welcome to another fun episode of Fun Facts at the Pharmacy. I am your host, Dr. Christopher Greider. In case it's the first time you're ever checking the show out, the purpose of this show is to give you guys some general information that can help make better life choices in regards to your medications or your health in general. We also kind of talk about some major topics that we find relevant so that people kind of understand their medications a little bit better. To start things off, I have a segment called Fast Acting at the beginning here. The purpose of Fast Acting is to give you guys some current information about stuff that's going on right now in the world. The big one I want to talk about today is we're getting closer to the fall season, so with that being the situation, flu season's just around the corner and immunizations is always a big thing. So if you've seen any of the previous episodes, we're very adamant about making sure people get their immunizations done at a proper time. So the first thing I wanted to talk about was when to get your flu shot. So as you can tell, we are wearing masks because COVID is a very serious situation that's going on. With that being the case, we want to make sure that everybody's getting their flu shots this year because we don't want to mix up the symptoms between COVID and the flu. We will have another episode that kind of talks about COVID in general so that people have a very good understanding of what that is and what to look out for. But a lot of the signs and symptoms between the flu and COVID are very similar because they're both viral infections in nature. So with that being the situation, they have actually increased it now. So the health department that works at the federal level has actually come out and given the okay for pharmacists now to give immunizations as young as 3 years old. Now, the main thing about that is there are a lot of people that have some comforts and some doubts about that, and especially like the American Pediatric Association has not been the biggest advocate of it just because of concerns. Now, being a pharmacist, we are 100% here to help out all of our fellow physicians with certain things like immunizations. But the thing to kind of keep in mind is that with pharmacies, a lot of us don't have a lot of experience with dealing with young children. So if you do choose to have your children have a vaccination at a pharmacy, please be patient. The main thing is that a lot of us have not had to deal with that before. It's a new territory that we're kind of venturing into, but it's a convenience for everybody because if, say, something happens and your pediatrician's overwhelmed or you're unable to actually go into your doctor's office for whatever reason, because a lot of doctors are not necessarily doing in-house visits or seeing people in person right now with COVID, it just gives an option and another alternative for you guys to come in. Now, the main thing is to verify with all of your pharmacies, wherever you choose to go, that they do have protocol in place to help take care of young children. Not every pharmacy has yet gotten to that point yet to allow those young of children to come in. As a prime example, Mark's right now, the youngest that we can typically do is 7 years old, according to most of our protocol. And even with that, I'm sure there will be some changes here in the near future, but if you do choose to go and do that, by all means, please call ahead just to make sure that they are well equipped to handle that and that they're able to do it for you at this time. The other thing that I'm also looking out for is with immunizations. The biggest thing that we've noticed with most people is that we want to make sure that everybody's not congregating and getting together at the same time to get their vaccinations. So with that being the case, the flu vaccine, most people have been asking me lately is when should I get it? You will see a lot of different places and pharmacies that are advocating and saying that they have flu shots available. According to the CDC right now, the main thing is they don't want you to get it as early as August. The reason being is you'll build immunity towards the flu virus. But the problem is the vaccination does wane a little bit, which is why you have to do it every year. That waning period where it's not working as effectively would then hit right towards the tail end of flu season, that it wouldn't do you any good. So they're recommending sometime about mid-September to early October is about the best time because then it'll give your immune system the best shot to fight against it all the way through up until the very end of flu season until next year when you'd have to get it again. Also, with that, we'd also like people to schedule ahead of time if possible, just because that way we're not having a bunch of people congregated together that are all waiting for the exact same thing. With COVID, we always want to maintain a 6-foot distance from another person if at all possible, and to make sure that you're wearing a mask. Most places have a policy in place right now where you do need to wear a mask when you come in. So just please make sure that you're wearing one as you come in, and then the pharmacist will typically do the same. Most of us will normally be wearing masks and face shields as part of a protocol. And there are extra questions that you do need to answer when you come in, so please give a little bit extra time for that just in case. With that being the situation, we'll move on to the main subject and topic today. We're actually going to talk a little bit about medications called anticoagulation medicines. With me today to kind of help talk about this is I actually have a student here with me from Neomed, and his name is Terry.
Thank you, Dr. Krander. My name is Thierry Nange. I'm a P4 student, and I appreciate all the taking care that you've been giving me to your community pharmacy, Mac Pharmacy. So.
Yeah. So kind of talking a little bit about it right now. So when we talk about anticoagulants or anticoagulation medicine, what are we talking about exactly?
When we talk about anticoagulant medication, usually a specific medication that are used to prevent blood to clot.
Okay.
So when we talk about it, I mean, we're talking about like warfarin, Eliquis, or Aliquis, Zoeto. So those medications, they're used to prevent your blood to clot. They do not treat the blood clot, but they just prevent blood to clot.
Okay, so we're just trying to prevent blood clots from actually forming, or more so than actually breaking the blood clots up.
Yeah, exactly.
Okay. Yeah, so for some people that would be put onto these types of medications, like in what disease states or what medical conditions would somebody be looking out for that may be put onto these types of medicines?
So first, you have to present patients who are using anticoagulant. They have to present with a risk of forming blood clots, especially when they have what they call atrial fibrillation, which means that they're having irregular heartbeat, or maybe they have a DVT, what they call deep vein thrombosis. Also, patient that they have a history of stroke. So those are kind of some conditions that will put patient into anticoagulant.
Okay.
So,
Yeah. So another group of people that we're normally looking at is that stroke risk is a big one, and typically heart attacks is what we're also looking out for, because that could be due to that as well. So when we're looking at things with that, what type of like medications, because you've named a couple of them so far.
Yeah.
So can you tell us one more time, like what was that list of medicines that we'd be looking at?
So we have what they call factor X10 inhibitor, like apixaban, that's a generic name, or Eliquis, which is the brand name. We have a warfarin or Coumadin. We have a endoxaban, which is also called endoxaban, which is also known as Safaisa. We have a rivaroxaban, also known as Zoreto. We also have what they call low molecular weight heparin, like Lovenox or enoxaparin. And we also have a medication like Predasa or dabigatran. So those are kind of list of anticoagulants that we have on the market. There are other many anticoagulants, but they are not very commonly used. But those what I just listed are commonly very used. So.
Okay. Yeah. So yeah, that was a good list because it kind of encompassed a little bit of everything that most people would normally see, at least on the outside.
Yeah.
When we're talking in-house patients, like if you're admitted into a hospital, you may notice some other ones that are out there. But our main goal is to kind of cover the ones that you would normally see, like in general, if you were out and about, or that maybe family members could potentially be taken as well. So kind of starting with that one. So the big one that always sticks out for this class of medicine is the one that you had mentioned, which was warfarin. Warfarin's been around for forever. It's been around since, I believe, the 1950s, if I'm not mistaken.
Yeah.
And the main thing behind it is a lot of people have associated it with rat poison. So it's an interesting concept because a lot of people get concerned, or I get questions of saying like, oh, am I actually taking rat poison? And the reality, the answer is that is correct. So with that being the situation, can you tell us a little bit about what warfarin is or how it works in the body?
So when you look at warfarin, like you said, it's been around for long. And the difference with warfarin compared to other anticoagulants that we have on the market is that warfarin it blocks your vitamin K from causing your blood to form clot. So the particularity of warfarin is that when you have a Eliquis, which is blocking just factor XA, which is factor 10, Eliquis will block your factor 2, factor 7, factor 9, and factor 10, also protein C and protein S. So Eliquis kind of act everywhere in your coagulation process. And compared to other anticoagulants, when someone is taking warfarin, you have to monitor the patient blood clot constantly, and compared to other coagulants that do not need monitoring. So Eliquis is kind of, warfarin kind of have a big range of control compared to other anticoagulants. You have to monitor it constantly, weekly, monthly, to you make sure that the patient is stable before you can stop monitoring constantly. So.
Yeah. We included here an image for you guys. That image kind of shows you a general breakdown as to where everything's kind of working. So a few of the main medications that Terry just mentioned, as you can tell from this image, kind of help to show like where in this, as they term it, the clotting cascade. So essentially, if you cut yourself and you started bleeding and then all of a sudden it stops bleeding, this is what's going on in your body, is these clotting formations start forming, and it helps to block that. So with that being the case, so that way you guys can visually see it, there is an image that's going to be right here that kind of shows you just like all the different spots that Terry was talking about. And as you can tell, warfarin kind of hits different parts of this clotting cascade all the way down until you get to the very end where you actually form the clot itself. So with that being the case, so you did mention that there's some monitoring that's involved with warfarin.
Yeah.
With that, what kind of monitoring are we talking about?
So when you start taking warfarin, there's what they call the international normalization ratio, which is this ratio kind of tell you how your blood is clotting. And let's say if you have a patient who's had a atrial fibrillation, AFib, so the normal range of your blood clot had to stay between 2 and 3. So, and weekly when you start the medication of warfarin, every week they have to measure how fast your blood is clotting to make sure that you stay in the range of 2 or 3. And the reason why they have to do that is because it kind of decide which type of tablet of warfarin you will be taking, because you have tablets of warfarin between 1 and 10 milligrams. So if you have your normal range is higher than 3, that means that your risk of bleeding is very high. And if the range is lower than 2, that means that your risk of clotting is very high. So between these two numbers, your doctor is going to tell you how often you have to take your tablet and which strength you're taking. And once you stay in your range, I mean, after a certain time, maybe for 4 to 6 weeks, if you stay in your range of 2 to 3, then your doctor can stabilize the type of strength that you're taking, and you're going to continue taking that strength till you're done with your treatment.
Perfect. Yeah. So we're aiming for that 2 to 3 range. Is what you're saying. Then. Okay.
This is just for AFib. So if there are patients that the range can be between 2.5 and 3.5. If you have a heart valve replacement, a prosthetic valve in your heart, so that means your range is going to go up a little bit. So it depends on which disease condition you have. So that's how they decide.
Okay. And yeah, I would safely say most patients normally fall within that 2 to 3. Like you said, the mitral valve replacement is a little bit different. So that's normally where the range might bump up a little bit.
Yes,
there.
exactly.
And it's interesting that you mentioned, so there are different strengths of warfarin, like you had mentioned. The universal thing, and this is one of the rare medications that I always find interesting, is that color-wise, you'll never have a different color for each of the different strengths. So no matter who manufactures it, if you got a different drug company that was making it for you, universally with this medicine, all of them have to look the exact same color. The markings or the shape of it can be different between manufacturers, but the main thing to keep in mind is they do want to keep the color the same. So that way, if you open your pill bottle and you looked in there and you notice a different color than what you've always gotten and you've always taken, that's an alarm to kind of tell patients to look out for it, to kind of make sure that you're questioning whether or not there was any changes, unless you and your doctor had spoke about it and they were making a change on your dose. So kind of talking a little bit about warfarin, since we know what we're kind of looking for right now. What are some good key points that people should know that are taking warfarin? Like, what are some things they should be looking out for?
First, the main thing when you're taking warfarin is that you have to make sure that you keep measuring your INR ratio. If your doctor tells you to measure it every week, because some patients have to go to a specialized clinic to get that number, to get that blood test, and there are some patients who has the device at home, so they have to measure it and make sure that you take note down. So each time that you measure your blood clotting factor, you make sure that you put the note down. If you miss a date without taking your medication, make sure that you inform your doctor, because missing a medication 1 or 2 days can kind of cause a frustration on your INR number. So you have to also make sure you're taking the medication as it was prescribed. You have to make sure that you're taking it in timely. And also you make sure that if you're having difficulty filling up your prescription at the pharmacy, you can talk to the doctor or talk to the pharmacy so the pharmacy can contact the doctor so that you can get your next prescription 1 week before. So, and make sure you also talk to your doctor anytime that you see something unusual happening, like side effect of breathing, and also if you're you're vomiting the blood, stuff like that. You have to make sure that you wash stuff like that when you're taking the medication.
Yeah. So if there's any unusual bleeding that's occurring that normally wouldn't typically happen.
And like I always talk to the patient when I was talking about counseling, always make sure that you're able to call 911 if you fall, if you hit your head, because if you're having a bleeding and you're taking all these anticoagulant, your risk of bleeding is going to just go up. So you have to make sure that if you have any unusual fall, you hit your head or bump your head on something, to get yourself to the emergency department so that they can check you and make sure that you're not having any internal bleeding. The goal of anticoagulant is to help you to help your blood not to clot. And if you're having a bleeding inside your body and you're taking anticoagulant, your bleeding factors just can go up. I mean, you increase your risk of bleeding more. So they're going to take you off if you're bleeding inside your body, if you are taking all this anticoagulant. So.
Gotcha. Okay. Now, one of the things that a lot of patients always ask me too is that with this particular medication, there are kind of some like dietary restrictions, or they have questions about like can they eat, or what are they supposed to avoid, because their doctors will sometimes mention it, but they may not go through with it. So what can you tell us a little bit about that?
So when you start taking warfarin, usually when the patient is put on warfarin at the beginning of the treatment, they want to see how often you're eating vegetable, because you know the mechanism of action of warfarin works by inhibiting your vitamin K. And most of our fruit that we eat, like vegetable, broccoli, cabbage, and livers, they are rich of vitamin K. And if you're eating vitamin K, at the same time you're taking a medication that's block the action of vitamin K, you're basically creating nothing happening in your body at that time. I mean, the drug will not work properly. So they want to make sure that at the beginning of the treatment that they have a patient eating a consistent diet of rich in vitamin K, and they will give you a strength of the tablet of warfarin, and they will make sure that you keep the consistency in your type of vitamin of vegetable that you're eating, and then they can tell at which time what strength is appropriate for you based on how you eat and based on your diet. And also you have to make sure that you avoid vitamin that contain vitamin K at the same time, because this kind of create frustration in your INR number. So that's the kind of restriction diet that you need to have. And if you're trying to eat more vegetable, you need to make sure that you talk to your doctor that I'm eating a lot of vegetable, I'm moving into a vegetarian diet. So the doctor is going to kind of change the type of tablet that you will be taking for your warfarin.
Yeah. So as they like to sometimes term it, like the way a lot of the vegetables that you mentioned, they typically term it as green leafy vegetable, dark green leafy vegetables is the best way to term it. So, so with those particular medications, like you said, anything that's high in vitamin K, that's the big thing that we're just trying to avoid in general there. So perfect. So kind of stepping away from warfarin, because we did have talked quite a bit about it, looking at some of those other medications that you mentioned, because you said there are a few other ones like the Xarelto, Pradaxa, and Eliquis are the big ones that you normally hear about. What can you kind of tell me about those ones there?
So the advantage on those anticoagulants is that they are very appropriate for patients that have compliance problem. I mean, patients that they can't follow a strict diet in terms of vegetable. So, and also they don't need a monitoring in their blood. They don't need a blood test weekly. And also they have they are very fast. Onset action of those medications are fast compared to warfarin, that the onset action is very slow. So, and something also, they are cheap, they're expensive also. So if you have a good insurance, you can afford those medications. That's where you can use them. But the advantage compared to warfarin is that they don't need any monitoring, and you don't need any restriction diet with those medications. And you can take them based on if your insurance can afford you to pay for. So.
Yeah, so you bring up a really good point. So from a cost perspective too, warfarin, because it's been around since the 50s, it's been around for so long that it's dirt cheap comparably to any of the other newer ones. I mean, the constant monitoring is probably the hardest thing about that when you compare the two. But yeah, like you said, that's the main thing that we're looking at, is that from a cost perspective, if you try to get put on these newer medications, or say you've been on them for a while and they're starting to become extremely expensive, warfarin's a good backup alternative just in case, but it's inconvenient for people is the main thing. Like you mentioned, the newer ones, you're really not having to worry about that too much, which is great. And I think the dietary restriction part is probably one of the best things about it, is that there's really no dietary restriction that occurs with them. Taking a look at that, I know with the Xarelto, one of the biggest points that they always want us to stress to people is, depending on how big your dose is, determines whether you should take it with or without food. So the biggest thing is, typically, if you're taking 10 milligrams of Xarelto or less, you're actually not required to take it with food. But anything above that, they do recommend with food. And it has to deal with a little bit with the mechanism on how the medication works in your system in order to help protect you a little bit too. So yeah, so looking at that one right now, one of the biggest things that we come across is the cost. So those medications have now been around for a little bit longer, which is great. I have seen a lot of the costs come down with them, which is fantastic too. And most insurances are behind one of those particular products. So if one's not covered, then they can typically get started on another one. But you did bring up a good point. So in case of an issue where, say, a patient's insurance is giving them a hard time, they're just getting started, they just got out of the hospital, and a doctor wants to get them started on it. Is there anything they can do in the meantime in case their insurance doesn't want to cover it for them?
I think the best thing to do, some doctor that I've seen doing, is they'll put them sometimes on Rovenox, which is low molecular weight heparin. When they are, most patients in the hospital, they don't usually use the liquids immediately or the warfarin. They will be using low molecular weight heparin, and by the time that they are at the hospital, they will be looking at coupon or patient assistance program to help them to afford for the medication. And that's what I see a lot of doctors doing in the hospital. So they kind of help them. They will put them on low molecular weight heparin, and they will bridge the patient by the time the patient can get the medication once the insurance can approve them.
Gotcha. Yeah. So they can use alternative medicines, like you said. The other thing that they sometimes can do too is that, depending on the office, they do sometimes have samples. With COVID going on, samples have been a little bit harder to come by, from what I've been hearing from a lot of patients in some of the doctors' offices. But it would be an alternative to at least give them a couple days to get them started.
Yes.
Because there are ways to get those medications approved with insurances. It just takes some documentation and paperwork from the doctor's office side. But with that being the case, that would be another alternative that they could possibly go down as well. So kind of talking about that, with a lot of these medications, one of the biggest things that we always come across with, especially prescription-based medicines and things like that, is there's a lot of interactions that sometimes can come up with these. So are there anything, for a normal person, is there anything that they should be looking out for that they might have in their cabinets that they shouldn't be taking with these medicines?
So we have a lot of medication that we can afford without a prescription, like we call over-the-counter medication. So what we usually tell patients is that before you get it, you're trying to pay for your medication in the store, make sure you talk to your doctor, especially ibuprofen and Motrin or Aleve. Those medications, they are not recommended when you're taking anticoagulant. And if you're having a small headache or a pain, acetaminophen is the more appropriate medication to use during that time. And if you're taking a prescription medication like amiodarone, they can try to decrease the dose of anticoagulant, especially for the warfarin, to see how the two can be mixed together. And also there are some medication like phenytoin, and they need to be, you don't need to be on this medication if you're taking warfarin anticoagulant. So make sure the patient is always recommended to talk to the prescriber when they're trying to fill up a prescription that can interact with the anticoagulant. And even when they have a new medication, they should make sure to talk to their prescriber about the new medication, because the provider is going to check to let them know if the medication is appropriate. And we also recommend that they can also talk to their pharmacist in the store if the pharmacist is have the time to give them, or you can call the provider and let them know that, hey, this medication is not appropriate for you at this time, and what can I do, which medication can I use that to replace the medication the patient is trying to pay for. So that's one of the recommendations we try to give them sometime.
Yeah. So yeah, that's the main thing. You kind of just nailed everything right there for you. If there are any serious questions or concerns, I mean, your pharmacists are always there for you too, because we're the ones dealing with your medications. But like I said, your physician, your pharmacist, even nurses are sometimes a good resource just in case there's any questions about any of those major drug interactions. Now, one of the other things that normally comes up with these types of medicines, and we always have to be careful about, is in case of an emergency. So we're talking, in case somebody did fall and say, busted themselves open and have a giant gash that was going on, or say a pet or a child happened to come across the medicine and just consumed a bunch of it right then and there. Is there, what would be the best recommendation in those particular situations?
First, you call 911 in this type of situation, so that by the time they get to you, you call 911, and you can also call Poison Control Center to get they can tell you what type of medication, or if you have vitamin K at home and that you can use. But mostly you call 911, and when they get you to the hospital, they're gonna give you what they call reversal agent, like Cassandra or phytanodione, which is just vitamin K. Especially if you're taking warfarin, if you have a child that took too much warfarin at home. So vitamin K is just a reversal agent that can be used to reverse if you took too much of that medication. So I would recommend call 911, because I know these medications are not accessible to everybody, I'm not sure if anyone has the medication at home. So those medications are mostly used in emergency room, those anti-reversal agents. So call 911, and the reversal agent can be used there to reverse if you took too much of the medication. So.
Yeah. And that's the main thing too, is that in a community setting, when you normally see your pharmacist out and about, that is not something that we actively carry. It is only typically carried at your hospitals, like you mentioned. So yeah, the emergency room is the best thing, but like I said, poison control is not a bad one to refer to, because they'll kind of tell you the concerns or things to look out for, or they'll tell you to just go in right away as well. So, well, awesome. Well, thank you so much, Terry, for kind of talking about some of these medications here with us, if anything.
Well, thank you, Dr. Grinder, for having me here. It was a good experience. We are still in the process to get everything in process in the brain. We've been learning a lot in school, and right now we're trying to apply everything that we did in school in theory on the field. So I appreciate all the opportunities that you gave me to be here, and thank you very much.
Absolutely. Well, once again, like we always say, pretty much if you have any questions, concerns, anything that you thought was interesting or wanted to learn about further, we do typically say you can talk to your physician, your nurses, and your pharmacist. We're all there as valuable resources to help you guys out, to make sure that we're helping you out and nothing bad is coming from it, of course. But with that being the case, thank you guys for joining us, and then we look forward to seeing you here the next time on Fun Facts at the Pharmacy.